This is Andrea, and I'm here with you for HIT 210, and I want to talk to you about National Correct Coding Initiative, or NCCI, and those edits. NCCI was created to promote national correct coding methodologies and control improper assignment of codes that resulted in improper reimbursement for Medicare Part B claims. So that's why CMS implemented the NCCI program, or NCCI edits. They are used when processing Medicare Part B claims for hospital outpatient and physician services. And the coding policies of NCCI are based on the following: analysis of standard medical and surgical practice, coding conventions included in CPT coding, coding guidelines developed by national medical specialty societies, and local and national coverage determinations. Those are the NCDs and LCDs, as well as review of current coding practices. So NCCI edits were initially developed for use by Medicare Administrative Contractors, or MACs, that process Medicare Part B claims for physician office services. And then they were added to the outpatient code editor in 2000. And now they're used by MACs to process Medicare Part B claims not only for physician office services, but for outpatient hospital procedures and services. So that's why we're talking about it. And there's some information here. For instance, you can locate MedLearn articles that contain OCE updates if you go to cms.gov and click on the Outreach and Education link, and then click on the Medicare link followed by MLN, Medicare Learning Network Matters articles link. Talked about how the MACs replaced fiscal intermediaries, and how they process the bills and the claims and all of that. So let's look. This is a partial list of National Correct Coding Initiative edits. So there's an edit for invalid diagnosis code, an edit for diagnosis and age conflict, an edit for diagnosis and sex conflict. There is an edit for a Medicare as a secondary payer. There is an alert for mutually exclusive procedure that's not allowed, even if an appropriate modifier is present. There is an edit for a component of a comprehensive procedure that is not allowed by the edits, even if an appropriate modifier is present. There is an edit for a mutually exclusive procedure that would be allowed by the edits if an appropriate modifier were present, meaning it's missing the appropriate modifier. And there's an edit for component of a comprehensive procedure that would be allowed if the appropriate modifier were present. So if you see NCCI edits 39 and 40, that should clue you into you're missing a modifier. And what they'll do is they'll have a line item rejection on the claim. 19 and 20, they'll say, hey, we're not interested in this. We're not, even though you've got the modifier there, we're not paying for it. It doesn't meet our criteria. And they'll also do a line item rejection. And then the others, obviously, they'll tell you for the first three, they need to return the claim to the provider to get those conflicts or the invalid diagnosis code corrected before they'll accept the claim. If it's a Medicare as secondary payer alert, which would be NCCI edit number 4, they actually suspend the claim because they want to hold on to it and let it go through whatever insurance is the primary payer first. Okay, so next page. All right, so it just reminds you that you need to make sure that you are really looking closely at things, that you're not unbundling. And we've talked about that if you need to go back and review the video on unbundling. CMS does post the CCI edits on the internet. You can actually go out and take a look at those, because they will put in there about how the code pairs should not be billed together, or they're a mutually exclusive edit. They're unlikely to be performed on the same patient on the same day. So you can go out and actually look at that. You can Also see payment rates. If you go out to cms.gov and look up the physician fee schedule lookup tool, you can determine in advance about what they'll be paid for a particular service or range of services. And let's see here. So again, you can go to look those up. These are places on cms.gov that will explain the CCI edits, the NCCI edits, and that's the Medicare Claims Processing Manual. If you end up doing coding and billing for physician practice on a regular basis, you will definitely want to be familiar with that. Then they have program transmittals and frequently asked questions, and all of those are available, as is a policy manual for Part B that the MACs have to follow. And now they give you an example here that this would be an example of you can't separately code in it if they're you can't add other codes if they are already integrated into the code. And then they give you an example of unbundling. And we've talked through unbundling, but basically it's using multiple codes when there's one available that already includes all of that. The example they give here is a 64-year-old female patient undergoes total abdominal hysterectomy with bilateral salpingectomy and oophorectomy. A review of the 3 CPT codes show that reporting 58700 and 58720 in addition to 58150 is considered unbundling. And if all 3 codes are submitted on a claim, reimbursement for codes 58700 and 58720 would be disallowed, and the provider might be subject to allegations of fraud and abuse. And remember, fraud is intentional, abuse is unintentional, and that's why it says it depends on intent. And unbundling can also occur when a code for a separate surgical approach is reported in addition to a code for the surgical procedure. Typically, the approach is included in the surgical procedure. All right. Let me see, there was one more page here. Yes. And this just gives you some exercises that you can look at if you want. But what's important here is this summary. CPT codes are reported for services and procedures provided by home health care and hospice agencies, outpatient hospital departments, physicians who are employees of a healthcare facility, and physicians who see patients in their offices or clinics or inpatient homes, to promote national correct coding methodologies and control the improper assignment of codes that result in inappropriate reimbursement of Medicare Part B claims. CMS has implemented NCCI, or National Correct Coding Initiative. CPT organizes Category 1 procedures and services into 6 sections. That includes E&M, or Evaluation and Management, Anesthesia, Surgery, Radiology, which includes nuclear medicine and diagnostic ultrasound, Pathology, and Laboratory and Medicine. The CPT index is organized by alphabetical main terms printed in boldface, and appendices are located after Category 3 codes. CPT sections are subdivided into subsections, categories, and subsections. Guidelines, notes, and descriptive qualifiers are also found in CPT sections, subsections, categories, and subcategories. 2-character modifiers are added to CPT codes to clarify services and procedures performed by providers. And then it goes on about symbols, but really it's just being aware of this NCCI information. If you have any questions, shoot me an email. Thanks.